afternoon. I'm Chris. I'm a nurse practitioner student. Welcome to our office today. What's your name?
Nick.
Nick, good. And what's your occupation, Nick?
I'm a pharmacist.
Okay. Can you tell me the date today?
Today is April 28th, 2021.
Good, good. And tell me where you're at right now.
I'm at the doctor's office.
Wonderful. Okay, so we're going to start off, we're going to do like a head to toe assessment, and I'll tell you every step of the way what we're doing. So for now, you can just sit and relax. We're going to start with your head and your face. First, I'm just going to inspect your skull. If you know any tenderness when I palpate, just let me know. Okay, good. You can look up. I'm going to palpate your joint here. Go ahead and open your mouth for me and close. One more time. Good. I'm going to check your frontal and maxillary sinuses. Any tenderness there?
Nope.
Okay. If you test some of your cranial nerves, if you can for me, can you clench your teeth for me? Good. And squeeze your eyes shut. Good. Stick out your tongue. Good. Puff your cheeks out. Good. And then we're going to also check some of your sensation. So I'm going to use this light touch here first. So I'm going to ask you to close your eyes. Should have had this open, huh? Okay. And I'm just going to touch a couple of places, and you let me know if you feel it.
Yeah.
Okay.
Cheek.
Good.
Forehead.
Good.
Arm. Foot.
Good.
Knee.
Wonderful.
Hand.
Okay. Thank you. We're also just going to check right now while we're here your temporal pulses. Two plus. Wonderful. And then I'm just going to listen to them with my stethoscope. No worries. All right, we're going to move to the eyes. If you don't mind, just look straight ahead. Go ahead and raise your eyebrows for me. Wonderful. Okay. And then I'm going to get a little chart here. I'm going to ask you to cover one part of your eye. Actually, try and read it for me first. Read to me the last line you can read.
FELOPZD.
Wonderful. Now cover your left eye and read it. See if you can read that same line.
FELOPZD.
Okay. And then your right eye. Read it backwards for me.
DZPOLEF.
Okay. Great. Okay. Next, I'm just going to shine this light into your eyes, okay? Just look straight ahead. Wonderful. Now, follow me with this, follow this pen with your eyes. I'm just going to move it up here. Good. Okay. And then follow again this pen. I'm going to move it towards your nose. Good accommodation. Good. All right. And then we're just going to look here into your eyes. Okay. And then look in your right eye. There's the red reflex. And then just going to get a little bit closer and look at the lens. Good. There's the red reflex. And I'm just going to look at your lens. Look straight ahead for me. Good. Okay. Next we'll look at your ears. I'm just going to make sure everything looks okay. Palpate your auricle and your mastoid. Okay. I'm going to stand over here. Can I ask you to cover your left ear? And I'm going to stand over here and whisper to you a saying, and I'd like you to repeat it.
Okay. 12 baby monkeys.
Okay, now cover this ear.
13 green watermelons.
Very good. All right. I'm going to take a peek into your eye. The canal looks good. Tympanic membrane is intact. And this side. Okay. Now we're going to do 2 more tests for the ears. I have this tuning fork here. We're going to do what's called the Rhine test. And I'm going to pound my tuning fork and I'm going to put it over your mastoid bone and then in front of your ear. And you make sure you can still hear it on both sides of the ear, okay?
Yes. Yes.
Okay.
Yes. Yes.
Good. And now the Weber test, I'm just going to pound it again and then I'm going to put it on here and you should hear the vibrations in both of your ears.
Yes.
Okay, good. All right. Next, I'm going to look at your nose, so if you don't mind just looking up. I'm going to look at your nose. Good. Looks patent. Okay, if you can open your mouth. Wonderful. All right, stick your tongue out for me. Good. Tonsil's not real big. Go ahead and move your tongue up and down. Good. And left and right for me. Okay. And one more time, say ah.
Ah.
Good. One more. Ah.
Ah.
Good. Wonderful. Okay. Next, we're going to look at your neck. I'm just going to, and I might ask you to remove your shirt at this part of the exam. Thank you. Okay. Just going to palpate. Trachea is midline. Go ahead and swallow for me. Good. We're also going to check another one of those cranial nerves right here. Go ahead and shrug your shoulders against resistance. Very strong, 5+. Okay, and then I'm just going to go through and palpate your lymph nodes, okay? So we're going to start here with the periauricular, and then the post, occipital, submaxillary, and submental. Your superficial cervical, posterior cervical, your supraclavicular, and your infraclavicular. Good. Next, I'm going to look at your neck here and palpate your carotid artery. 2+. And 2+. Take my stethoscope and listen. Next, I'm just going to mess with your neck one more time and I'm going to look at your thyroid. Okay, I'm going to move it to one side and the other, and when I do that, I'd ask you to swallow, okay? So I'm going to move it to your left, thank you, and then to your right. Good. Okay. All right, wonderful. Now we're going to look at your upper extremities. If you can just put your arms out straight here. I'm going to inspect them, feeling for warmth, edema, any tenderness. They're symmetrical. I'm going to check your skin turgor. Wonderful. We're going to look at your nails, and do me a favor and put your thumbs together like that. No clubbing. Good. And I'm just going to check your cap refill. Very good. Next, your radio pulses. Nice and strong, 2+. And brachial. Okay. Next, I'm just going to ask you to turn this way so we can have your back to the camera there. I'm going to inspect the back of your back, or the posterior of your back, and look for any skin lesions, any moles that don't look like normal moles. There's no scars. Scapula and spine look great. And then we're just going to, I'm going to palpate right here by your kidneys. And then I'm going to percuss. Wonderful. Okay. Go ahead and take a deep breath for me. Good. This is thoracic expansion. Go ahead one more time. And my thumbs are symmetrical moving. Next, I'm going to do a tactile fremitus. And when I ask you to say the word 99, go ahead, 99.
99.
Again.
99.
Good.
99.
Okay. And we'll go lateral. 99.
99.
Good. At this point, we would check diaphragmatic excursion, but we've already done that, and you were 4 cms on the left and 4 cms on the right. So that's within normal. I'm just going to listen to your back. We're going to be taking deep breaths. Go ahead. One more back here. Good. And we're going to check lateral. Good. Take a couple deep breaths and relax a little bit, okay? Next, I'm going to ask you to turn yourself all the way around so you're facing this way. Okay, and then we're going to look at the front of your chest. There's no scars or anything, normal hair pattern, everything looks symmetrical muscle-wise. And then at this point, we could take your respiratory rate and rhythm, but you're easy unlabored, and likely we would have taken your rate at some point earlier. Next, we're going to palpate your chest just to make sure there's no heaves, which is a lifting. You can just breathe normal. And while you're sitting, I'm going to listen to your lung sounds in the front. Deep breath. Good. Good. Okay. For the next part of the exam, it's easier to lay down, so if you don't mind laying your head on that pillow. Okay. For this, we're just going to inspect your precordium and also palpate, okay? So I'm just going to be feeling around on your chest. My first spot is to the right of your sternal border, second intercostal space. This is the aortic valve. This is where we would hear it. And then to the left of your sternum, second intercostal space would be where we would feel or hear the pulmonic valve. Third intercostal space, and then the fourth intercostal space is where we would feel hear the tricuspid valve. And then we'll palpate at the fifth intercostal space. And then we're going to walk to midclavicular, and this is where we would hear the mitral valve. This is also the apex of the heart. And I'm just going to find your maximum pulse. Right here, you can just relax. Good. And then I'm just going to listen in the same order that I explained to you that I was palpating. I'm just going to turn that little stethoscope around and listen with the bell of my stethoscope. Just relax, nice even breaths. Okay, we're going to stay laying, S1, S2, great heart sounds. I'm going to just look at your abdomen, and I'm going to sneak down to the foot of the bed and look. It looks symmetrical, round contour, no palpations that I see. And I'm just going to listen to your bowel sounds. We're going to start in your right lower quadrant and listen. Good bowel sounds. Next, I'm going to listen to a couple of your arteries, your aorta, and then your renal, iliac, and then your femoral. Next comes a little percussion, a little tap on your belly, okay? Good. If you can, put your arm out. Check your spleen there. Good. Okay. One more little palpate here. This is your gastric bubble. Good. Next, I'm just gonna I'm sorry, that was a percussion. I'm gonna palpate your stomach. Let me know if there's any tenderness. And this one is gonna be a little bit deeper palpation. Good. Next, we're going to look at palpate your liver and your spleen. Midline and around your umbilicus. Good. Just gonna check some reflexes. I'm gonna take my hammer and I'm not gonna pound on your stomach, but I'm gonna use the end of it and I'm going to brush it up towards your face and then brush down towards your feet. Good reflexes. Good. And one last thing with your abdomen, I'd like you to raise your head off the pillow and hold it there for just a minute. Good. All right. So we're done with the abdomen. Next, we're going to move to your legs. We're going to look at your legs, okay? I'm just going to inspect them. They have good color. When I palpate, they're warm. There's no edema. I'm going to palpate your popliteal pulses. 2+, 2+, and then your pedal. 2+, 2+, and then your posterior tibial. And that's 2+. We're just going to do some range of motion while you're laying there. If you could, bring your legs straight up. We'll test your hips out and then down, and then the other leg. Good. And then have your leg bent and try and go across your body. Good. And then out. Good. Same with the other leg. Good. Good. And you can straighten your legs. Go ahead and push down and pull up. Good. All right. While you're laying there, I'm just going to check your hips and feel for your femoral artery here. Great. Okay. Now we'll just go ahead and have you sit back up here. Couple more things, and then we'll be done with our testing. So I'm going to have do some sensory testing, your sensory function. I've got a paper clip, and I have a dull end, and I have a sharp end. Okay, so I'm going to either put the sharp end on your arm or a part of your body, or the dull end, and you're going to close your eyes, and you're going to tell me which one I put on your body. Okay, so this is dull, and this is sharp. Can you tell the difference?
Do the sharp a little harder.
Okay. All right, here you go.
Dull.
Good.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Good. And next we're going to use this tuning fork again. And my hammer. And we're going to, I'm just going to pound it like usual, and the stem of it I'm going to put on your wrist and your ankles, and you should feel a vibration. You let me know if you don't, okay?
Yes. 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 Yes.
Okay, good. That's vibration sensation, so that's good and intact. Okay, I'm going to move your great big toe up or down. I'll have you keep your eyes closed, okay? And you tell me if I'm moving it up or moving it down.
Down. Up. 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 Down.
Good. Same with your finger. Keep your eyes closed.
Up. Down. Up. Down.
Good. Keep those eyes closed for me. We're going to test your asterognosis. And what I'm going to do is I'm going to put a common item in your hand, and you're going to tell me what it is. You can go ahead and feel it. There's your right hand.
Penny?
Yep, that's a penny. Good job. Keep your eyes closed, and this is going to be in your left hand.
Key on a keychain.
Yep, very good. Okay. With those eyes staying closed, I'm going to check your graphesthesia. I'm going to trace a letter in your palm, and you tell me what you think the letter is.
B.
Yep.
N.
Good. All right, you can open your eyes now. Good. We're just going to test your upper extremity fine motor and coordination. So what I want you to do is take your fingers, and I want you to alternate touching your nose like this. Good. And then we're going to test your rapid movements. I want you, as fast as you can, go back through your fingers like this, touching your palm, touching your thumb. And then try to speed it up as much as you can. Good. Okay. And then we're going to test the lower extremities. What I want you to do next is take your heel and run it down your shin. Good. And the other leg, please. Wonderful. And then I'm going to ask you to sort of let your legs hang. So we're going to check some reflexes, your deep tendon reflexes. So we're just going to check your bicep. You can relax. Good. Good. And then we're going to check your radial here. And then back here is a tricep. Good. Patella. Okay, and your Achilles. Good. I'm just going to run my hammer up your toe there. Good. Those are good reflexes. All right. Last thing we'll do is some standing. So I'll ask you to go ahead and stand. And for me, if you don't mind walking to that door Good, and you can turn around, and then on your way back, I want you to walk heel to toe. Good, you can walk back normal. If you don't mind facing that wall, and I'll have you bend over, I'm going to inspect your spine. And you can stand up. Just going to palpate your spine here. Good, and then we're just going to do some range of motion, okay? So what I'm going to ask you to do is go ahead and bend forward as a flex. Good, and then hyper extension is back. Good. This is called lateral bending, side to side. And then rotation of your trunk. Good. Okay, we're just got a couple more tests. The Romberg test, I want you to stand with your feet together, your arms at your side, your eyes are open, and I want you to close them. There's a little swaying, but not anything out of normal, so you have a negative Romberg step test. Keep your eyes closed, and I want you to stand on one foot, and then the other. Good. Good. And then, one last thing, hop in place on one foot, and then the other foot. Wonderful. Okay, you can go ahead and sit down. That ends our exam. Do you have any questions for me?
I don't think so.
Okay, well, thank you very much.
Thank you.